Welcome to this presentation about the surgical procedure called vertical sleeve gastrectomy. When performed in select candidates who are motivated to change their lifestyle for the better, weight loss surgery is a tool that can significantly improve the health and well-being of morbidly obese patients. By the end of this presentation, you will have a clearer understanding of the sleeve gastrectomy procedure, its risks and benefits, and the commitments required to make the surgery successful. As you know, obesity is associated with many other illnesses, including cardiovascular disease, diabetes, some cancers, gallbladder disease, soft tissue infection, and impaired circulation. In fact, obesity is one of the most common causes of preventable death. Weight loss surgery like sleeve gastrectomy has proven to be an effective method for weight loss in those who qualify. The following nutrition goals are very important and will guide you through the rest of the journey to a new, healthier life. Stop the weight gain. This will be your first milestone of success. Achieve this goal and you are on your way. Lose weight. The second goal is to decrease calorie intake. Achieve this by following our nutritional goals and meal plans. Keep lean muscle tissue. Muscles help your body. Vertical sleeve gastrectomy is a purely restrictive and irreversible procedure. 85% or more of the stomach is cut and removed from the digestive tract, creating a slim banana or sleeve-like tube. However, all the nerves of the stomach and its outlet to the intestines remain intact, so the normal functions of the stomach are preserved. Weight is lost after sleeve gastrectomy because the amount of food calories that can be digested and absorbed by the body is drastically reduced. Patients feel fuller faster because the newly created tube shape creates resistance to volumes of food and has been shown to resist expansion over time. It has been found that the urge to eat is suppressed after surgery as well. This is attributed to the removal of the stomach portion that secretes ghrelin, the hormone responsible for appetite and hunger. Since ghrelin levels near zero after sleeve gastrectomy, a loss of appetite is created. We store fat around our organs as well as under the skin and in our muscles. In most cases, fat is stored in the liver as well. Because fatty livers are larger than normal, the weight loss procedure becomes more difficult and time-consuming. An enlarged liver may increase the chances of bleeding during surgery. Studies have shown that a high-protein and low-carbohydrate diet can help decrease the size of a fatty liver. We require all patients to start such a diet before surgery. Patients may be eligible for vertical sleeve gastrectomy if they meet the criteria mentioned earlier and can demonstrate a several-year history of failed attempts to lose weight through drug therapy, diet, and exercise. Most insurance companies and weight loss surgeons look for a several-year history of supervised and independent attempts to lose weight conservatively. As a standalone procedure, sleeve gastrectomy is ideal for those who are concerned about the risks of intestinal bypass, such as intestinal obstruction, ulcers, anemia, osteoporosis, and other deficiencies. Those who are considering gastric banding but concerned about the implantation of a foreign device or the need for frequent adjustments. Those who are ineligible for other weight loss surgery procedures due to medical problems like anemia, Crohn's disease, extensive prior abdominal surgery, severe asthma requiring frequent steroid use, and patients who need to take anti-inflammatory medications to manage other medical conditions. Here is a diagram of the surgical procedure. It can be performed with an open technique or laparoscopically. The new stomach sleeve capacity is only about 1 to 5 ounces. Even though it has been drastically reduced in volume, normal stomach functions are preserved because its nerve and its outlet or pylorus remain intact. Complications of sleeve gastrectomy can occur. There is even a slight chance of death from these problems. The most frequent complications are similar to those after gastric bypass. These are gastric leak, which is a leak of stomach fluids from the stomach suture line, excessive bleeding, infection, pneumonia, pulmonary embolism, which is a clot that forms in the legs or pelvis, breaks off and travels to the lungs, nausea or vomiting, dehydration, gastric ulcer, or stenosis, which is a narrowing or blockage of the passageway from the esophagus to the stomach. Ask your surgeon to explain the frequency of these complications in his or her practice. On the day of your surgery, you will be asked to move about in your hospital bed, transfer from your bed to your chair, and will even get up to go to the bathroom. Your doctor and the hospital staff will monitor your recovery, and you will begin with the first phase of food progression, the liquid diet. Discharge from the hospital is dependent upon the condition of your wound, normalization of your vital signs, and your ability to tolerate liquids without discomfort. Please speak to your primary care physician or your surgeon before stopping or changing any medications. The following medications will require specific attention. Stop nonsteroidal anti-inflammatory drugs, which include but are not limited to Advil, ibuprofen, aspirin, Aleve, and naproxen. Prednisone should not be stopped without consulting a physician. Talk to your physician about stopping blood thinners, which include aspirin, Coumadin, Plavix, Agrinox, Persantin, Ticlid. Even some vitamin and herbal supplements such as vitamin E can cause increased bleeding. Women should stop estrogen hormones 1 month before surgery. This may not apply to all hormone situations, so talk to your physician. If you're using hormonal birth control, you must use alternative forms of contraception to avoid pregnancy. Patients who are deemed good candidates for vertical sleeve gastrectomy should be prepared to make a serious lifestyle adjustment. This includes a commitment to exercise at least 3 to 5 times per week, compliance with the recommended diet progression eating plan, giving up bad habits like smoking, follow up with your surgeon regularly, visit your family physician as indicated, and finally, you can look forward to improved overall health and well-being. Thank you for watching this presentation. If you would like to review any or all of the information in this presentation, you may do so at any time by clicking on the table of contents to the left of your screen.